Hello, I'm Dr. Bhatchandra Shekhar Bhatia. Today we are going to talk about female sexual disorders. It's a very common disorder. It's a persistent and recurrent distressing sexual concerns or difficulties. Is likely underappreciated what is very common female problem. Female sexual dysfunction is divided into three categories: female sexual interest or arousal disorder, female orgasmic disorder, and genitopelvic pain or penetration disorder. Female sexual interest or arousal disorder is characterized by a lack or significant decrease in sexual activity. This may include lack of or significant decrease in interest in sexual activity, or sexual or erotic thoughts or fantasies, excitement or pleasure during sexual activity, and initiation of sexual activity or responding to a partner's initiation. Female orgasmic disorder is characterized by a significant delay or infrequency or absence of orgasm, or significantly decreased intensity of orgasm or during sexual activity. Genitopelvic pain or penetration disorder is characterized by persistent or recurrent difficulty having sexual intercourse, experiencing vulvovaginal or pelvic pain during intercourse, fear or anxiety over the vulvovaginal or pelvic pain, tightening of pelvic floor muscles during attempted vaginal penetration. Diagnosis of sexual disorders requires that the symptoms of each disorder occur more than 5% of the time for at least 6 months and cause clinically significant distress. Beyond the three categories of female sexual dysfunction, women may experience sexual dysfunction within after pregnancy. Perinatal events like cesarean section or instrument delivery or perineal tears may cause pelvic pain. Estrogen levels are lower during breastfeeding, which may result in vaginal distress. Dryness, postpartum depression may contribute to decreased sexual desire or frequency. Menopause and genitourinary syndrome of menopause may also affect sexual dysfunction because of vaginal dryness may contribute to the pain with vaginal intercourse. When assessing sexual dysfunction, it is important to realize that sexual functioning involves multiple components, including emotions, relationships, past experiences, physiological responses, oral health, and personal beliefs, like cultural beliefs. Therefore, a comprehensive approach is needed to evaluate and treat the condition. Assessment of female sexual dysfunction include detailed questioning regarding patient's sexual and gender identity, symptom characteristics, include duration and acute or gradual onset, and if the specific partner and generalized concern, association with the pain, precipitating events, level of distress caused by the symptoms. In addition, assessment should include current life stresses like lack of job, medical and surgical history, medications, history of physical, emotional, and sexual abuse. Screening for concurrent depression is also indicated. Female sexual index or the female sexual distress scale can be used during assessment. Pelvic examination is aimed at assessing the specific sites of pain or tenderness, vaginal dryness or atrophy. Painless of vagina are also judged. Laboratory testing is of limited value, is performed only if the underlying cause is suspected. Therapy is aimed at underlying cause of the female sexual dysfunction, which is often multifactorial. There are two FDA-approved medications for female sexual dysfunction. Number one is pimavanserin, serotonin receptor agonist and antagonist, is approved for premenopausal women with female sexual interest arousal disorder without repression. It uses limited secondary to side effects. Side effects are dizziness, syncope, hypotension, or somnolence. Incidence of side effects is increased when combined with alcohol or other medication antidepressants. It can be used only at night, 100 milligram pills daily at night. So after 24 hours, and use should be stopped if no effect is seen within 8 weeks. The second medication is bremelanotide. Bremelanotide, subcutaneous injection, is taken 45 minutes before doing sex. So it's used for hypoactive sexual desire disorder, HSDD. It's a subcutaneous injection taken under the skin in premenopausal women. It can be used only 8 times per month and cannot be used, only used 24 hours one time. The second injection can be used only after 24 hours. Side effects include skin darkening, nausea, and vomiting. Off-label use which are not approved for HSDD disorder. Number one is bupropion, antidepressant. It's not approved. It's off-label use. Number two, low dose testosterone is also being used. It's not approved or for this purpose, but it's being used It can cause side effects. And number 3 is a Ayurvedic medicine called Ristella. It's made up from pine bark and stem of rose plant. Also includes arginine, amino acid. It comes in form of capsules, one a day. Doesn't have any specified side effects. So this was everything regarding female sexual dysfunctions. Thank you. Bye-bye. Next time, next video. Bye.